we can get started now. So welcome everyone to today's CPC Connecting Generations webinar. Our speaker for today is Dr. Matthew Wallace. Matthew is a reader of Social Inequality at the Centre for Research on Inclusive Society at the University of Salford, as well as a visiting researcher at the Stockholm University Demography Unit. His research interests include migrants and their children, morbidity and mortality, as well as equality and inequalities, integration and inclusion. Matt was recently the recipient of a UK Research and Innovation grant to study whether international migrants are living longer lives in worse health compared to non-migrants. And today he'll be presenting on international migration, mortality, and national population health. So I'll hand over to Matt now to get started.
Wonderful, thank you very much. And just to say as well, thank you for the invitation. So if you don't know, I've been outside of the UK for the last 9 years. So it feels nice to reconnect with the demographic community, aside from the usual visits to the SPS from time to time. Can I just check that you can see my screen and you can hear me clearly?
Yep, we can see you and hear you fine.
Wonderful. So I won't repeat any of Sarah's wonderful introduction. I will crack straight on with the meat of the presentation today. So I just wanted to provide you with some background about migration and migrant mortality. We all want to convince other people that what we're doing is important and worthwhile. So I'll just try and lay some groundwork before I show you some results. So this is a graph from the International Organization of Migration, and it shows numbers and shares of international migrants as a share of the world's population between 1990 and 2024. And essentially it tells us two things: that certainly the absolute number of migrants has increased over time in the last several decades, from 150 million in 1990 to 304 million by 2024. And that broadly we can say the same thing, albeit with much lower growth in relative terms, to 3.7% by 2024. Excuse me. But what's really interesting is, of course, that these absolute and relative shares are spread geographically unequally around the world. So there are much larger absolute and relative shares of international migrants in certain parts of the world. And those parts of the world include Northern America, of course, where 16% of the resident population are born elsewhere. Europe, where 12% or 13% even of the resident population are born elsewhere. And of course, Australia and New Zealand, where around 22% of the population are born elsewhere. And that's broadly reflected in the absolute numbers as well. If I'm being very selective, which I am, this wasn't very scientific. I just picked out a number of countries with the absolute number of migrants, the relative share as a percentage, and a very broadly calculated fraction. So forgive me if there's any errors in there, but we can see that for certain countries, the relative share of migrants has become really quite significant over time. So broadly, 1 in 3 people who are living in Australia were born elsewhere. 1 in 4 people in Switzerland and New Zealand, 1/5 of the population in countries like Canada, Sweden, Austria, and Germany, and generally in high-income countries, and certainly major migrant-receiving countries, international migrants now form a substantial share of the total resident population. But what's really interesting is it's not really or simply just growth in absolute and relative numbers of migrants. We've also really seen a diversification of migrants over time. Now, I always forget what these plots are called. These were Nikki Sander and Guy Abel's plots, maybe circular plots, but maybe not. But they're really wonderful diagrams that show us migration flows between different regions of the world. And hopefully here we'll see the increasing diversification with this little video that I'm about to show you from 1990 to 2024. And it's particularly interesting, I think, to focus on Europe at kind of 2 o'clock in green and North America at kind of 11 o'clock there, just to see the diversification simply and where migration flows are coming from. And there's diversification everywhere, right? But it's nice to focus, I think, on those two in particular for the purpose of this presentation. But we see a real diversification in migration flows over time. So we have increasing absolute and relative shares of migrants. We have a diversification in where migrants are coming from, and particularly also their reasons for arrival as well. And we'll get onto that in a little bit. But there's also persistent and robust evidence in the literature of a lower risk of all-cause mortality among migrants. This is broadly referred to as the healthy immigrant effect, or more specifically referred to as the migrant mortality advantage. We can use the term healthy immigrant effect to also refer to mortality risks among migrants, but not the other way around. But these are the two kind of prevailing, albeit somewhat problematic, theories and frameworks even that we use to study the mortality and health of migrants. So I just wanted to highlight two studies, two recent meta-analyses and systematic reviews of the migrant mortality literature. The first by Robert Aldridge and colleagues, and that was conducted as a commission between the UCL and the Lancet. So that was the Lancet UCL Commission on Migration and Health several years ago. And they conducted this really nice systematic review and meta-analysis, and they showed broadly an 18% lower risk of mortality among male migrants globally compared to non-migrants, and among female that was 28%, sorry, not 18%, and among female migrants broadly a 25% lower mortality risk. There was a more recent meta-analysis conducted by Shaw and Rolfs. I think that was in International Migration Review. And, you know, we do quantitative analysis, right? But we make subjective decisions. So different papers are included in this more recent systematic review, and different parameters are considered more important or less important. But they also estimate a lower mortality risk, albeit of a lesser magnitude, that's going in the right direction, or at least the same direction as Aldridge et al. So there's a 10% lower risk of death among male migrants and a 13% lower risk of death among female migrants. And this is wonderful, and this is all very interesting, but it also really masks a great amount of heterogeneity in the mortality risks of migrants. And you know, so I've highlighted some characteristics here, or some more specific outcomes, just to really showcase that while we might observe these things when we're looking at all foreign-born combined, or when we're looking at all-cause mortality, we're really masking a lot of variation in various different migrant-specific characteristics, demographic characteristics, and various other things too. And even now, with these examples, I'm making broad generalizations. But when we look at cause of death, for example, we might find a lower all-cause risk of mortality. And that remains true for broadly cancers, albeit there's variation by cancer sites. But there's a really persistent elevated risk of diabetes among migrant populations that seems to stick around really irrespective of where people are born or why they're arriving. And in general, we also tend to observe a higher risk of communicable diseases among migrants as well. There are many more causes of death and much more variation, but this is just to kind of try and make a relatively succinct point. Of course, we can look at country of origin as well. And there's great variation in the mortality risk of migrants by country of origin too. So somewhat counterintuitively, and this is just one of many paradoxes in the migrant health literature, the mortality risks of migrants tend to be most prevalent, most consistent, and strongest among migrants who were born in low middle income countries who are moving to high income countries. When we look at high income to high income migration and the mortality risks of those groups, we tend to observe much weaker mortality advantages, or even mortality disadvantages among those groups. We can think about migrant-specific characteristics like reason for arrival. You can imagine your risk of mortality and your health upon arrival might be very different if you're a highly skilled labour migrant arriving to take a job that you've expected, compared to if you're arriving because of political instability or war in your country and have endured a long, arduous journey to get to the country that you need to get to. We can think about age as well as a classic demographic characteristic, and there's quite a bit of evidence now that's showing the mortality advantage and health advantages of migrants are strongest among young adult migrants. We also have age at arrival and duration of residence as well. And these three characteristics together kind of form this nice migrant-specific age period cohort problem, right? It's like if you know the values of two of these, you can derive the third one, and it's really hard to isolate their individual effects, right? But we have age at arrival, and we observe that mortality risks among migrants are reversed. If they're arriving as children, they tend to have excess mortality risk compared to non-migrants. They have very strong advantages if migrants are arriving in young adulthood, and weaker to non-existent advantages if they're arriving at older ages. and of course duration of residence as well, where the general finding, albeit with variation, tends to be that the health and mortality risks of migrants at best when they've just arrived in a host country and accelerate at a faster rate than non-migrants with increasing duration of residence. So there's these kind of two prevailing theories, of which there is a wealth of evidence, but there's also a lot of heterogeneity and variation when we start to look and dig into specific characteristics or specific outcomes. But kind of what I want to demonstrate with this background section are these three things, right? We know that there are rising shares of migrants throughout the world, both in absolute and relative terms, and that those shares are concentrated unequally throughout the world, particularly in certain high-income countries, that there's been a real diversification of migration flows around the world, and that the mortality risks of migrants are lower, albeit with potentially marked variation at times according to specific migrant background and demographic characteristics. So why is migrant health important? And I always kind of like to think about these three pillars: people, systems, and processes. So we talk about people. Our own health is important to us, right? Having good health affects our ability to participate in society, but the conditions we experience in society also influence our health, right? You think about systems, particularly healthcare and welfare systems, and many kind of high-income country welfare systems were set up at a time when these countries had very homogeneous majority white populations, and these populations are now much more diverse. Migrants have specific health issues and specific health needs. They might need specific modes or methods of accessing healthcare or receiving healthcare. And we're really starting to question whether healthcare systems in their current form are capable of meeting the needs of an increasingly diverse population. And the same is true for welfare systems as well. And finally, the third pillar would be processes, where I often think about migrant integration, both at the national level, integration policies and processes and how they're bearing out over time amongst migrants and their children, but also these kind of local individual level integration processes between both migrants and non-migrants themselves. So people, systems, and processes. So the gap, and I never really like to call it the gap. I think it's appropriate for a presentation perhaps, but you know, there's lots of good research out there and still lots of good research to do. Doesn't necessarily mean anyone's missed anything, but call it a gap for the sake of this presentation. So my feeling in the migrant health literature is that migrant health has always been kind of treated as discrete and decontextualized from wider population health. We look at the health or mortality patterns of migrants and we contrast them with non-migrants, and we kind of leave things there. We never really talk about the health of migrants in a wider national population health perspective. So I think two questions we ask very often are: what are the differences between migrants and non-migrants in terms of a given health or mortality outcome that we might want to investigate? And then we also might ask, why are there differences between migrants and non-migrants? And we might theorize or specifically look to test why the health of migrants, again, with whatever given health outcome you choose, might differ from the health patterns of non-migrants. I think much less frequently asked in terms of questions is, what are the consequences of the differences to national mortality when the mortality of migrants differs from non-migrants? What does the effect of that unique mortality risk have on national population health? So there are previous studies, of course, of the contributions of migrants to national life expectancy more than anything. And the first of these, to the best of my knowledge, was conducted in Australia with kind of prevalence-based 5-year census data. And they looked at the impact of migrants on national life expectancy over time. So this is just a small table here outlining the study that was conducted, the country in which it was conducted, the years that were included in the study, the life expectancy metric taken, and the largest documented effect among men and women, alongside some description of the overall trend over time. So in Australia, they documented an increasing positive effect over time, to the point where female migrants were enhancing national life expectancy by 0.4 years, and male migrants were enhancing national life expectancy by half a year. And they argue that these increases were not trivial and had helped elevate Australia's position in global national life expectancy rankings. Following that study, there was a study by Aaron Hendy and Jessica Ho in the US. So they took 1990 to 2017 and they calculated these contributions annually, so every year for these 27 years or whatever. They took life expectancy at age 1. We can get into why that might be a little later on. But they documented particularly large effects of international migrants of between 1.23 and 1.35 years among female migrants and 1.22 to 1.45 years among male migrants. So really large positive increasing impacts of migrants on national life expectancy over time. We know that the general mortality situation, and particularly the mortality situation among non-migrants in the US, is a little funky right now and has been unique for a while compared to high-income countries. So that may go some way to explaining this particularly sizable effect of international migrants on national life expectancy in the US. And then there was a study that I led with colleagues in Stockholm, Denmark, Finland, and Norway. And we also looked over a similar period to Hendy and Ho. We had a couple of years extra data, and we found increasing positive effects in 3 countries. Now you'll see those effects are considerably smaller than Australia in the US. So around 1/10 of a year, if we're being generous, among men and women migrants in Denmark, and up to kind of 1/5 of a year among male and female migrants in Norway. What was really interesting in this paper was that Sweden was the first time we've observed an example where migrants actually had a negative impact upon national life expectancy. And that was minus 1/10 of a year in 1990 among female migrants and minus 1/5 of a year among male migrants in 1990. What was even more interesting in Sweden was that that negative impact slowly disappeared over time and kind of broke even by 2019 to the point where the life expectancy of migrants, and all migrants combined here, right, just foreign born, and that's the same for all these other previous studies, was kind of similar to non-migrants, and they were no longer having an impact upon life expectancy at all. So just to cover the E0 versus E1 debate, so that's life expectancy at birth versus life expectancy at age 1. So the reason that Hendy and Ho rationalize using life expectancy at age 1 is because we're calculating life tables, and from life tables we're deriving life expectancy. And there are very few, if any, migrants who arrive as very young children, and especially few who arrive in the first 28 days of life, where the risk of infant mortality is highest. So they argued that life expectancy among migrants specifically was being overestimated by taking life expectancy at birth. Now, in this paper that I did with colleagues that I've just kind of mentioned here, we tested that specifically, and we found that to be true. Life expectancy among migrants is overestimated if you take life expectancy at birth, but it does not have any impact upon the actual contribution of migrants to national life expectancy at this point. So we have these previous studies, and Australia, Denmark, Finland, the United States, and Norway. Although there's variation in the size of the effect, the trend in these countries is very similar. There's an increasingly positive impact of migrants upon national life expectancy over time. And Sweden kind of stands alone as an island in that migrants initially negatively affect national life expectancy, and even today do not have a positive impact upon national life expectancy in the country. So kind of the natural question, and these are the results that I'll cover today, are what's going on with Sweden. What sets Sweden apart from these other countries, especially the other countries in the Nordic region, where migration flows have been broadly similar over time, albeit with some differences. So I just want to cover some Swedish migration history. I don't want to assume that we all know about Swedish migration history, because why would we? But I worked there for 5 years, and I got to know my Swedish migration history very well, I hope. And Sweden really became a country of immigration following the Second World War, which it maintains that it was not involved in any way. And this started with post-war refugee migration from other European countries, particularly the other Nordic countries, and certain other Northern European countries as well. And immigration kind of really took off from 1954 onwards, with the Nordic Common Labour Market Agreement. We might consider that broadly similar to I think it's the Common Travel Area Agreement between the UK and Ireland, but basically it allowed free movement of people between the 5 Nordic countries, come for labour, no permits required. Alongside that, in the 50s and 60s, there was invited labour migration from countries like Greece and Turkey and former Yugoslavia. And that's really interesting because Sweden kind of set itself apart at that point when a lot of other European countries had guest workers, but assumed or maintained that those guest workers would return to their countries of origin. Sweden set itself apart and assumed that those labour migrants or those guest workers would stay and integrate into Swedish society. By 1972, Swedish government enforced an immigration stop, so it no longer invited labour migrants to come and work in Sweden. But that basically just led, as in many cases in many European countries, to new waves of family reunification. Family migrants are those who had labourer partners who had come to Sweden to work. From 1970s onwards, there was a real shift towards refugee migration. So in the 1970s, there was a considerable number of arrivals from Chile following the Pinochet regime. In the 1990s, from former Yugoslavia. In the early 2000s, from Somalia, Eritrea, Ethiopia, Iran and Iraq from kind of the 80s onwards, but also in distinct waves as well. And of course, from Syria in the mid-2010s, right? And finally, in 2001, Sweden agreed its Schengen membership, and that, of course, led to an increase in arrival from various European Union countries as well. So it's a real diverse mixture that started with this kind of majority overwhelming intra-Nordic migration following this common labour market agreement, but has really diversified over time to migrants arriving from many different countries for many different reasons. So kind of the research question or aim was to kind of take this finding from this previous paper, of course, recontextualize migrant health within the health of the wider population of Sweden, and ask what is the impact of the mortality of international migrants on national life expectancy patterns and trends in Sweden. And the idea is that we would do this broadly by generation, so including migrants and their children, by age, through age decompositions, and by migrant origins. I'll say at this point, we also looked at refugee status at some point, and I will cover that briefly when I talk about the origin-specific patterns as well. For the data and methods, I'm not going to get too bogged down in things. There's nothing kind of trailblazing or super complicated going on here. For the data, we're using the total population administrative register data. The context is Sweden. The study period, we're mirroring the study period from the previous study, so from 1990 to 2019. We're generating single year life tables and decomposing differences using the Arriaga decomposition method. And in this study, we're actually estimating life expectancy at birth rather than life expectancy at age 1. And that's because actually the way we do our calculations is to combine the first and second generation together. So we combine migrants and their children before decomposing the differences. And then it becomes important to include infant mortality because the second generation children of migrants are born in Sweden. And we know that they have quite a forceful and persistent excess infant mortality risk. And we really wanted to capture the impacts of that on national life expectancy in Sweden. We produce annual estimates, and our migrant definition is being born abroad, nativity status. We do some decomposition by broad origin regions, but fundamentally, if you were not born in Sweden, we consider you to be an international migrant. We always, as ever, do our quality checks, and we compared our total life expectancies to the human mortality database and information from Statistics Sweden. And most of the time, we are completely bang on to 2 decimal places with our life expectancy estimates, which we should be if we're worth our salt. I will outline who the we is. So that's myself. Of course, I conducted this paper alongside Sven Dreyfall at Stockholm University Demography Unit, another unashamedly classic demography nut. And so let's get on to some results. So I'll kind of show you some descriptive results to give you a little bit more of a flair of what Sweden looks like and migrants in Sweden look like. And then I'll show you some life expectancies and decompositions as well. So this first table, we're broadly looking at generation here. Down the left column here, the first left column, we have every 5 years. On the top side of this table, we have absolute numbers, and on the bottom half, we have relative numbers. And then taking the columns across after year, we have the majority population being born in Sweden to 2 parents born in Sweden, the first generation being born outside of Sweden, and the second generation being born in Sweden to at least 1 parent who was born in Sweden. And again, we did some sensitivity analyses around those definitions as well. But broadly, what's really interesting is that we can see that in absolute terms, the numbers of the majority population in Sweden are actually decreasing over time, whereas the absolute numbers of the first and second generation have increased quite considerably over time. So effectively, migrants and their children in Sweden are sustaining population growth in the country. But also we can see that in 1990, the first generation or migrants accounted for 9% of the total population of the country of Sweden, and that moved up to 19%, or 1/5 of the population by 2019. And the relative share has also doubled as well among the second generation, among the children of migrants, from 7% of the population to 14% of the population broadly today. So here I'm showing you some life expectancies. And on the left-hand side, in the horizontal axis, we have life expectancy at birth. And on the vertical axis, we have our years. So the total population, the total resident population, that's a solid black line. The majority population is a dashed black line. And the first and second generation combined, migrants and their children combined at this point, are this kind of blue dash dotted line. The blue shaded area represents the impact of the first and second generation. So that's the difference in the life expectancy of the total population versus the majority population, which is how a lot of these previous studies have kind of operationalized this gap between migrants and non-migrants, or the contribution of migrants even to national life expectancy. So we plot females and males, of course, on the same panel here. I think that's quite intuitive and nice to see. But broadly, we'll take males first. We can see that life expectancy among migrants and the children of migrants combined is considerably lower than it is among the majority population in 1990. And that gap kind of slowly and stably decreases over time to 2019, where migrant life expectancy and migrants and their children, their combined life expectancy is still a little bit lower than that of non-migrants, but it's caught up considerably. And that's kind of reflected in the narrowing of this gap over time as well, right? From kind of minus 0.19 years to essentially 0.01, 0.02 years by 2019. So it's a really clear pattern among male migrants and their children in Sweden. Their life expectancy starts a lot lower and catches up. And this kind of larger, albeit still small in absolute terms, effect of migrants on life expectancy, this negative impact diminishes over time. We can kind of broadly say the same among female migrants as well, albeit the pattern is much less pronounced and a little bit choppier. And so we move to kind of decomposing this gap. Sorry about that. We move to kind of decomposing this difference between total population life expectancy and non-migrant life expectancy. So now we have a multi-panel, and on the left-hand side, in the vertical axes, we have the contributions to differences in national life expectancy. So within the panels itself, if these bars are below the line, that's negative. That's a negative contribution to national life expectancy. If they're above the line, that's positive, and that's a positive contribution to national life expectancy. We have males on the top row and females on the bottom. On the vertical axis, we have the year, and taking the sub-panel columns across, we have the first and second generation combined, migrants on their own, and the children of migrants on their own. So really this first column here is really reflecting the narrowing of this gap, right? We're just showing a more detailed and intuitive way to visualize this gap between migrants and non-migrants. And we see that gap or negative impact of migrants diminishes over time. That's broadly reflected in the first generation, both men and women, but particularly among men, the pattern and the trend is particularly clear. This kind of lower contribution or negative contribution to national life expectancy in 1990 that actually becomes positive among both male and female migrants by 2019, albeit almost entirely negligible in terms of the absolute number that we're looking at there. But then what's really interesting, I think, is that among the second generation, and again, we have males on the top and females on the bottom, the contribution of the children of migrants to national life expectancy is actually growing increasingly negative over time. In absolute terms, it's still very small, but I think the pattern among men or the trend among men even, is particularly clear. So we kind of have these contrasting trends among migrants and their children and their impact upon national life expectancy. So then we take age. And again, I'm just showing you the descriptive figure because I kind of want you to see the ages at which migrants and their children have the potential to have the most impact, right? So when there's larger relative shares, they can potentially have a greater weight in calculations of the life tables and of national life expectancy and have a greater impact upon that overall public health metric, right? So we're split into 4 panels here. We have age 0 to 4 on the left top, age 15 to 39 on the right top, age 40 to 64 bottom left, and ages 65 plus bottom right. The majority population of this kind of very light blue bar, migrants, the first generation, of this dark blue bar, and the children of migrants are kind of this mid blue bar, right? So basically, what do we see? We can see that over time, and we have both the absolute and relative numbers here, right? We have the absolute numbers plotted on the horizontal axis, and we have the percentages within the bars. We can see increasing shares of migrants and their children at all ages, generally over time, but we can see certainly that migrants are most highly concentrated at ages 15 to 39. So by 2019, they account for 26% of the resident population in those ages, and at ages 40 to 64, where they account for 23% of the resident population of those ages. And among their children, we can see that really, and this makes sense, right, because they're a generation behind, that the children of migrants are broadly concentrated at the youngest ages, with a good level of representation at ages 15 to 39 as well, right? So when we're thinking about age decompositions and the effect of migrants and their children on specific ages, it's likely that migrants will have their largest effects in young to mid-adulthood, and that the children of migrants will have their biggest impact, if any, in infancy, childhood, and early adulthood. I'm sorry, this is a lot of information to take in, so hopefully I can provide a good description of it to save you having to pore through this panel. But this is a result of the Arriaga age decompositions, right? So on the horizontal axis, we have age now. So we had year before, but now we have age on the horizontal axis. On the vertical axes, we still have contributions. So we're still similar to this axis. We're looking at contributions. We have 3 columns. The first column is 1990 to 99, the second is 2000 to 2009, and the third is 2010 to 2019. And then we have 4 rows. So the first 2 rows correspond to the first generation, with men the top row and women the second row. And the bottom 2 rows correspond to the children of migrants, the second generation, and men on that third row and women on that fourth row. So within each panel, there are annual age decompositions, and then there is an average for the period, which is the thicker line. So all I really want to say about this is that there's some really interesting patterns that we observe over time among the first generation, first of all. So migrants actually contribute negatively to life expectancy in young to mid-adulthood in the 1990s, and that pattern or trend reverses over time to 2010 to 2019. So we can see this kind of almost systematic negative impact upon life expectancy in 1990 to 99 across all ages. It kind of disappears, this negative impact, by 2000 to 2009, and then a real positive impact upon national life expectancy emerges by 2019. We still see this persistent negative effect into older ages, and you can kind of see, if I'm being very generous, that it kind of shifts with age and kind of concentrates into a more concrete hump over time. So it's really interesting among migrants because there's now, in the most recent decade, a positive impact in young adulthood and a negative impact in old adulthood. And again, I always feel really dismissive when I say this, but the patterns are broadly the same, but less pronounced for female migrants as well. So for the second generation, for the children of migrants, there is an increasingly negative contribution in infancy. So if we kind of look at age 0 here, in 1990, it's certainly below the line. It gets further below the line in the second column and again in the third column. And so there's an increasingly negative contribution to infancy, and there's this kind of solidification of this negative impact of the children of migrants on national life expectancy in young to mid-adulthood, again, particularly among men. And we see that kind of emerge and strengthen over time, and that's very concerning. So I'll just finish with origins, right? So finally, well, this is the penultimate panel, I think. What I'm showing you here is the relative share. So this is migrants only now, right? I just want to show you or give you a flare of where migrants are coming from and how that's changed over time in Sweden. So the vertical axis is now the relative share of the population. So this is migrants only. We're back to year on our horizontal axis. And I divided it up by age as well to kind of link that to the age decompositions too. So the pink shaded area corresponds broadly to, this should say non-European populations. The light blue shaded area corresponds to other European populations, and kind of the dark teal area corresponds to Nordic populations. So these are migrants who were born in these countries who moved to Sweden. So what's really interesting for the first generation is that we can see in childhood, and at ages 15 to 34, certainly migrants predominantly come from outside of Europe, and increasingly so over time. What's really interesting at ages 35 to 64 is that there's been a real transition in where migrants come from predominantly Nordic countries at 50% here in 1990. So we're kind of third column across, looking at this dark blue area from 50% here, all the way down to kind of 15% by 2019. There's been a real transformation of non-Western migrants from being the minority in 1990 to the majority of all migrants and male migrants at those ages in 2019. Among the second generation, and again, we can kind of track this generational lag when we look a column back each time, which I think is super interesting. We can see that among child second generation, so ages 0 to 14, a really large share of migrants, or the children of migrants even by 2019, are from non-European countries. And that there's some sort of transformation going on in young adulthood from predominantly Nordic to a much higher representation of the children of migrants with parents born in non-European countries. But by older ages, and again, this is kind of expected given the generational lag, the majority of second generation are from Nordic or other European countries. So this is the life expectancy of migrants only, because we don't have enough representation among the second generation to put accurate life tables together. And I think this is really interesting because what we're seeing over time, so 1990 to 2019 on the horizontal axis and life expectancy at age 1 on the vertical axis, over time, we see kind of persistent differences between migrants from certain broad regions and non-migrants, rather than kind of changes in the magnitude of those differences. So we have female migrants on the top and male migrants on the bottom. That's kind of signified by those gender symbols at the end of the descriptor for the region that they're born in. And if we take women on the top here, we can see that actually, compared to the majority population, which is in black, non-European migrants have always had higher life expectancy. And although there's some kind of jump and variation over time in the actual value, which is, I guess, to be expected because the population is a little smaller, the actual magnitude of the difference remains relatively stable over time. And that's also true for Nordic migrants, who have consistently lower life expectancy across this 30-year period than the majority population do. So I think that's really interesting. It's kind of a consistent magnitude and a consistent direction of difference over time, rather than a shift, like an increase or a decrease in the life expectancies of certain groups. So this is the last panel, I promise. And this represents a decomposition of contributions to differences in life expectancies by migrant and the children of migrants' origins or parental origins, right? So we have first generation along the top. We have second generation children of migrants along the bottom. Men form the first column and women form the second. The color is consistent to previous visualizations. So the Nordic are kind of teal, or the Western are light blue, and the non-European, sorry, are in pink there. So if we kind of take the first generation, and again, we're back to contributions on our vertical axis now, we can see that Nordic men and women are contributing quite consistently negatively to national life expectancy over time, we might generously say that the impact of Nordic men is diminishing a little bit, but it looks quite stable among women. Whereas we can see that the impact of migrants who are born in non-European countries is actually increasing over time for both men and women among the first generation. When we look at the children of migrants at the second generation, so this is the bottom row now, we can see that there's a consistency there, at least, in that Nordic children of migrants are also contributing negatively. But there's kind of a reversal here, right, between generations of non-European groups contributing positively for migrants, but negatively for their children, which again is kind of concerning because these effects also look to be growing over time a little bit. So I'll just have some brief interpretation. So hopefully we can see from this set of results that there's an initial negative effect of migrants on national life expectancy in Sweden. That effect diminishes or reverses to kind of a negligible positive effect over time. For me, this is a story of migrant composition, the transformation of the impact of migrants on national life expectancy in Sweden is driven by increasing shares of non-European migrants over time. Point 4 here says irrespective of whether the non-Europeans were refugees or not. So we kind of looked at the impact of refugees and the impact of refugees within origins, and we kind of found that the country of origin or region of origin was kind of king here. So there's that. We found, which was really interesting, I think, a reversal in effects among migrants that was concentrated in young to mid-adulthood. And when we did kind of age, origin, generation-specific decompositions, we can see clearly that that can be attributed to young adult non-European migrants. They don't show that here, but it's available in the paper. Quite concerningly, we can see that there's a negative effect of children on migrants, or children of migrants on national life expectancy, that these effects are concentrated in infancy and early adulthood, and that while the non-European G1 first generation contribute positively, their descendants, their children, contribute negatively to national life expectancy. So just some discussion points. I had some more stuff, some more things to sell, but I'm not going to cover that. I was going to talk about the project a little bit, but time's getting on, and I'm sure you probably want to ask some questions. But it's undeniable that the impact of migrants on life expectancy in Sweden is small. Certainly compared to Australia, and certainly compared to the United States. But what's interesting about Sweden is it contrasts from the situation in other high-income countries. I think the results show the power of the changing composition of migrant flows and migrant populations, and the need for nuance in our analyses when we're just kind of taking all foreign-born and looking at the impact of that very heterogeneous group. There are clear divergent trends over time and across migrant generations, and I think the negative patterns and trends among the second generation are a particular concern. Is there a case for estimating the contributions of these groups separately? Clearly in Sweden, they have unique mortality risks along with the mortality risks of the majority population. And would it make sense to start monitoring these separate risks in order to inform policies that might be able to help Sweden improve or maximize its life expectancy gains? I wanted to ask about the effect on other population health metrics. You know, life expectancy doesn't take health, you know, the quality of your life into account. So do we need to move in that direction? I was going to move on to advertising my project, but I think I should probably say thank you and take some questions. But I do just want to advertise a podcast. I think he's on vacation at the moment, but this is a podcast that I did with Joseph Harrison in collaboration with the Office for National Statistics and Celsius. It's called Linking Our Lives. And Joe and I talked about migration and health in the context of the Office for National Statistics longitudinal studies. You can find it on Spotify. Listen to it on Apple Podcasts. It's about 20 minutes long. There was a really great episode beforehand on internal migration with the ONSLS, I think with Tony Champion and Ian Shuttleworth. And in general, it's just a really good podcast if you're a bit of a population/demography nerd. So thank you very much for taking the time to come and listen, and I'm really happy to take any questions. Thank you.
Thanks, Matt.